Hi, how are you? Can everybody see me? Okay, I can hear you. Can you hear me okay? Okay, hello. I'm Erin. What's your name? Hi, Tom. How are you? Okay, great. So this is our first visit together, um, talking at the care clinic. So have you ever talked to any other doctor or any healthcare person on a telemedicine visit? Okay. All right. So I'm going to walk you through it. And you have Maureen, who's the care coordinator up there at the care clinic in Key Largo with you. She's going to get some of the paperwork done with you, and she can answer any questions. And if you have any questions at all during a session, just stop me. Um, this is pretty much similar to a regular session in an office. Um, all the same rules apply basically, but we're just in two different locations, so that does create a little bit of challenge, and we'll just have to you know tell you about the differences and see if it works for you. Okay. So like I said, my name is Erin. I'm a doctor of nursing practice, licensed in the state of Florida. um, my license number can be obtained from the board, the Florida board, or Maureen, who's your case coordinator, can get it for you upon your request. Um, we are located, I'm sitting in the office right now at the care clinic that's down in Key West. So I'm on Kennedy Drive in Key West, and I'm at the phone number 305-294-5531. And my extension is 1231. And the number that you guys are at is the same phone number, but it's extension 1322. So if for any reason we have technical difficulties, we'll try and call each other, and Maureen will walk you through it, and hopefully we can get it resolved, or hopefully it doesn't happen at all. Okay. Um, this system that we're using, it's called Influxius. It is a company that we have a business associate agreement with. They used WebRTC software, which it contains all of the licensing that we need. It is HIPAA compliant. It's an encrypted software, and it's a really good streaming method. So we usually don't have any problems. We just have to kind of talk about it in case it happens. Um, Maureen is going to have you sign the privacy policies, the HIPAA information, and informed consent to treatment. You have to sign to do any treatment, but then you also have to sign an extra one to do this kind of treatment, telemedicine. Um, okay, all right. So far, do you have any questions? Okay, okay. You feel like you can hear and see? All right, great. Um, but like I said, the same standards of care apply in Florida to these kind of sessions as they do to being in a regular office. So the same stuff is going to happen. I'm still going to collect, you know, your information, and then I'm going to write an assessment and a note for our visits, and your records can be obtained if you want them or need them, and we can talk about that a little bit more. Okay. Okay. And the licensing in the state of Florida allows people to have telemedicine visits primarily. So if this works for you, we can just talk on this method, and you know, we can even prescribe medications on this method. But the if it doesn't, if you didn't like it, or if you felt like you needed a higher level of care, I can always give you a referral to somebody close to you, or if you wanted to see me in person, you can make an appointment to come down to Key West and see me. I know it's hard for you guys to make it all the way down here though, so this actually usually works out better. Yeah. um, when you came in, I know you went into the business office. They signed you up for our grant funded care. It's everything is on a sliding scale. It is basically, I think, $5 for a visit, and then you can get signed up for our medication grant funded program as well. In the meantime, they're going to try and get you benefits through disability. I know that that's something that you were working on when you were an inpatient, right? Okay. So how that works is I can actually prescribe medicine through our visits here. And if you qualify for the grant funded program, you can pick them up at the pharmacy at CVS. Just the only things, we don't prescribe any kind of habit forming or narcotics, any controlled substances. We don't usually prescribe those kind of medications here anyway, but we aren't licensed to do it. I'm not as a nurse practitioner in Florida, and also we can't do it through telemedicine. So if that were a need, that would have to be seen from a different doctor. Okay. Are you currently seeing any other doctors, any for mental health or for medical? Okay, okay. And that just, I was wondering about records, because it's the same with the HIPAA. It's the same rules. If you were to see a doctor for medical needs and they wanted to get records from us, you would have to sign a release of information for us to give any kind of records out to anybody else. Okay, okay. So did you give Maureen your ID already? Okay. We just have to, verify that you are who you say you are, and I am who I say I am, because we're in different places. So that's why we had to make a copy of that, and then we'll have it in your chart just for your patient profile. Okay. Um, and also, your address and your phone number on your driver's license is the same. It's current. Okay. Okay. And we're gonna need to get an emergency contact number. Do you have somebody that you could give? Okay. Okay. Thanks. When we get the emergency contact number, what that is for is for an emergency situation, because this is considered emergency psychiatry service. So sometimes, and the only time that HIPAA, we might have to break that confidentiality is if we thought that you might be a harm to yourself or a harm to somebody else. So if, something that happened in our visit made me think that, I'd have to break that confidentiality and create some kind of a safety plan. So it might involve calling Maureen, the care coordinator that you are with right now, your emergency contact number. Does that make sense? And then, of course, if there was an emergency situation, like a medical emergency, we would call your emergency contact number. So we just want to make sure that it's somebody who you feel could help you in that situation. Just want to make sure that we check off everything on this list, so that you feel that you know what's coming next. Did you have any questions? Okay. Basically, we're going to meet today, and we're going to do your full assessment. I know it's a lot today because we have to go through all this and the business office and the assessment, but then, we're going to try and figure out your medications, and next week you're going to come in and get your labs. Then after that, usually we meet about once a month. That's the typical visits, and they're usually 45-minute sessions. Once you've been coming for a while, if you feel like you don't need to come that often, and we all feel like a treatment team you don't need to, we kind of talk about it. Me, the psychiatrist, Maureen, your case manager, and maybe other social workers. And then sometimes people come every 2 months, sometimes people come every 3 months. It really depends how you're doing. But basically, if you have any medication side effects ever, or you have any medical emergencies, you're going to want to call, either call 911 and go to the emergency room, or have somebody bring you safely to the closest emergency room. If you did need to contact me for more like an emotional crisis, you can call me. My cell phone number, we're going to give you the card. Take that with you. You can also call the care center if you just need someone to talk to. They have a crisis line. But I do check my voicemail every day. Usually get back to people within 24 hours. But again, if it's an emergency or you you need help right then, just go to the hospital, because that's always the safest. Okay. And then we haven't had any technical difficulties, so I'm expecting that this session is going to be okay. But just so you know, in the future, if anything were to happen with our session, we would have to we could talk on the phone for a few minutes if you wanted to just kind of finish up, but we'd have to reschedule because this isn't considered a real visit if it's just on the phone. We have to actually do the face to face on the video. Does that make sense? Okay. And then the video are held to the same standards of HIPAA as all of the other records of yours. So, we're never going to, this video is private, it's encrypted, and it wouldn't be released for any reason without your consent. Okay. But like we said, many of the patients, they really do like the video conference because it does keep you from having to come all the way down to Key West. But it's really a personal thing. So I don't know, how do you feel so far? Do you feel like this would be a way that you would feel comfortable talking to somebody about your mental health needs? Okay. Do you have any concerns about it? Okay. All right. Then I guess we'll go on to your history and physical. Thanks.